Today, I'd like to talk to you about some useful, say, medical words. Hi, I'm Danilo. For obvious reasons, doctors are very busy these days, and getting an appointment with a doctor is not always that easy. Before going to the doctor's office, people need to set a doctor's appointment. Doctors can be categorized as general practitioners, cardiologists, psychiatrists, pediatricians, obstetricians or OB, gynecologists, neurologists, and so on. Physicians use a stethoscope to examine patients. When a patient has lost mobility, they can use gurneys or stretchers to carry them. Next up, the hospital. Examples of hospital may include a neonatal hospital. Hospitals are composed basically of a reception room, a triage area, ER, ward, and ICU, with the following attributions. The reception room personnel are in charge of admitting incoming patients to the hospital. The triage area professionals are responsible for quickly examining patients who are taken to a hospital in order to decide which ones are the most seriously ill and must be treated first. Both ER and ICU personnel are concerned with tending to patients who are experiencing urgent, severe, or even life-threatening medical conditions. A ward is one of the rooms into which a hospital is divided, usually with beds for patients. For example, a geriatric, psychiatric, or maternity ward. Patients may report symptoms like gastrointestinal distress, pain, or headache. One of various types of surgery centers is the ASC. ASC stands for Ambulatory Surgery Center. An ambulatory surgery center, or ASC, is a healthcare facility where surgical procedures and other procedures that do not require an overnight hospital stay take place. Surgical instruments like scalpels, scissors, forceps, clamps, and clips are used. Scalpel. Let's try and break down some of these important jobs that take place in the operating room. The surgeon often specializes in a particular area of study such as trauma surgery, colorectal surgery, pediatric surgery, etc. Anesthesiologists. They are present before, during, and after the surgery. It's necessary that they are informed about the entire medical condition and history of the patient before the procedure. Certified registered nurse anesthetist, operating room nurse, surgical technologist. They are trained in hundreds of types of surgery and are able to anticipate next steps in the procedure. Other words that can be used when we are talking about medical conditions and doctors are paramedics, routine checkup, diagnosis, and prognosis. Syringe, IV or intravenous, chemotherapy, malignant, benign. Person can be discharged from a hospital when doctors consider that they've recovered from the condition that caused them to be admitted to a certain hospital.